Welcome back. We're talking to family nurse practitioner Erin Kuntzweiler, and now joining us is Dr. Douglas Kuntzweiler, an MD, or Doctor of Medicine. Thanks for joining us.
Thanks for having me.
Absolutely. So Dr. Kuntzweiler, we talked to Erin about nurse practitioners, and it sounded very similar to what doctors do in terms of treating patients. Can you talk about the differences between being a medical doctor and then your perspective of the differences with a nurse practitioner?
Sure. So it really is a matter of depth of study more than anything else. Medical doctors, whether you're an MD or an osteopath, have first an undergraduate degree. That may or may not be in a biological field. They then go to a medical school, and most medical schools are 4 years in length. After that, then they do a residency, and the residencies vary depending on the specialty. Family practice, for instance, is 3 years long. General surgery is usually 5 years long, and so they vary. A nurse practitioner has, first of all, her 4-year nursing degree, and then a 2 or 3 year nurse practitioner program. So the length of study is greater for a physician. But the thing I want to stress is that we're all practicing the same medicine. We study from the same textbooks, we attend the same conferences, we follow the same scientific literature, and we all try and follow best practices. And so we're all practicing scientific Western medicine. The difference is that physicians have a longer course of study, and therefore they have more experience and more in-depth training, but we're all doing basically the same thing.
So maybe we should take a step back, and you mentioned really a doctor of osteopathy.
Correct.
Or a medical doctor. So there's medical doctor, doctor of osteopathy. Right. Can you talk about the differences between the two?
Yeah, so everybody has all these initials after their name, MD and DO, and that is confusing for people. Historically, osteopathic physicians had a different perspective on the causes of disease back in the 1800s when that began. And they were much more like chiropractors, and they did a lot of manipulation, thinking that was the source of disease and that was the way to fix it. However, as time went on, they adopted the scientific Western medicine curriculum. And so for the last 75 years, osteopathic schools and MD schools have pretty much identical curriculum. So we both practice Western scientific medicine. MDs and DOs both compete for the same residency slots. And so from a practical standpoint, there's no difference at this point. You'll find ENT surgeons who were osteopathically trained, and you'll find general surgeons who are osteopathically trained. You'll find cardiologists who are MDs, cardiologists who are DOs, but we're all practicing the same medicine.
How do the MDs and DOs then collaborate with nurse practitioners or even physician assistants?
Yeah, physician assistants are a relatively new practice that were designed to sort of increase the number of patients that a physician could be responsible for and take care of. And so they attend a school that is usually 2 or 3 years long that includes a lot of mentoring, and they do the same thing that nurse practitioners do and the same thing that physicians do. They assess patients, they diagnose them, and they treat them. One of the differences is that PAs in most states have to have an affiliation with a physician, and that physician has to oversee their practice, review their charts, oftentimes countersign orders. And nurse practitioners in most states are free to practice independently. Having said that, we all collaborate with each other. So nurse practitioners, as I said, their training is shortened, and so they use physicians as mentors and as people that they can turn to when they have questions that they feel are beyond their expertise. As a physician, I do the same thing. I have patients I see that present me with unfamiliar problems, and I turn to other physicians who have specialties that can help me manage these patients. So we sort of all work collaboratively for the best interests of the patient. And it's just a matter of degree, I would say.
Switching to Erin, then how do you practice, Erin?
Yeah, so to talk about the point he made as far as independent practice, in the United States for nurse practitioners, each state board of nursing sets the bylaws on, independent practice. So Montana is an independent practice state, so I don't have to have a collaborative agreement with a physician. Personally, I am in private practice, but I'm in private practice with 3 physicians, 2 MDs and 1 DO. So I set myself up that way so that I had mentors, especially in those early years.
So how does a patient know who's treating them? An MD, a DO, a nurse practitioner, or even a physician assistant?
Well, I think professionally, the right thing to do when you introduce yourself to a patient is let them know what you are. Doug would introduce himself as, Dr. Kuntzweiler, and that's kind of a general, everybody knows then you're a doctor. But I introduce myself as Erin Kuntzweiler, NP, and physician assistants do the same. And as a patient, you should absolutely have a right to know what provider is treating you.
Okay, thank you both. We need to pause for a short break, but coming up next, how much do healthcare professionals work together to coordinate your care? We'll talk about that and what you need to do to be an informed and engaged patient right after this break. Stay with us.